Good morning, everyone, and welcome to Outside the Echo Chamber. I'm your host today, Doug Scaff, president of HD Media. We're excited to be here at the downtown studios at the Charleston Gazette-Mail building. We came to you live from the Capitol with all the fun and hustle and bustle under the dome, but we had an interesting topic this year, healthcare. Healthcare is always at the center and the forefront of how it affects West Virginians. And a lot of legislation this session, some that passed and some that didn't pass. And I'm really excited to have our guest with us today, and fairly new President Jim Kaufman, CEO of the West Virginia Hospital Association. Welcome to the show, Jim.
Good morning. Thank you for the invite.
I know we were talking about this like the first real session, where people came back to the Capitol, and I saw you up there until the wee hours of the night on day 60, about midnight. You were still there. In this show, we dive right into the issues and the topics, and one that I know you were tracking was Senate Bill 574. It would have increased the rates of reimbursement for PEIA, for the hospitalization of the patients. Tell me, why was this so important? What happened to the bill? Where is it?
Sure, this was a bill that actually had several lives in different iterations throughout the legislative process, but the bottom line was the goal was to increase the reimbursements to the hospitals. Right now, PEIA reimburses hospitals at 50% of the Medicare level. Medicare doesn't cover the cost of care, so this has been a huge financial burden on the hospitals, and this is one we've been asking policy leaders to address, because as we're trying to compete for the limited number of healthcare professionals across the country, we need to offer competitive salaries. We can't if we don't have the reimbursements to do so.
I mean, this thing took on a lot of its own. I mean, I thought there was a plan to take it up in the House, and then maybe in the Senate, and then maybe back in the House. I mean, what happened on that last day there? It had like 9 lives.
Sure. What happened was the first time it was introduced in the Senate, it actually was voted down. It was brought back to life, put in rules, and they restructured it, and that's when they looked at doing it for the entire PEA coverage, state employees and non-state employees. Then it passed unanimously in the Senate. When it went over to the House, it was moving. The issue has never been, should we increase the reimbursements? The issue is how to pay for it, because it's about a $40 million cost to the state. So the question was, should it be on premiums? Should it be on backfill for the reserve fund? And that was really the question. So at one point, there was an amendment added to the bill looking at spousal coverage for PEIA. And that was where it got some controversy. Then it got caught behind other bills, and the clock ran out on it. So the Senate did add it to other bills for consideration, and we just hit midnight before they could take it up.
And so bring it down to the people of West Virginia. So what does that mean? I mean, are hospitals, would they have to consider whether they're going to take PEIA patients or not? I mean, could it come down to that?
You could clearly see that. I mean, in other states, Medicaid is usually your worst payer. And in some places, doctors or hospitals limit the number of Medicaid patients they take because they can't afford to. So far, we've been fortunate in West Virginia, no one's doing that. However, as costs continue to skyrocket and you're competing for healthcare professionals, they may have to either limit or not accept PEIA. I would not be surprised if some physicians start to do that. Hospitals may consider it.
So where does it go from here now? I mean, have you talked with the legislature or any of the leadership about bringing this bill back up or a special session? Or, I mean, something has to be done.
You're exactly right. Something needs to be done. If you want to ensure access to care, we actually have to have the providers and to be able to compete nationally for these providers. So we are going back to the governor's office and the speaker and the president to ask them for reconsideration of this, whether it's special session or some other mechanism. We need to address this issue immediately.
One thing that we talked about also, I know, we talked about 9 lives. This bill, I hope the PEI gets addressed soon, because it's something you can't kick down the road. Another one that it seems like it comes up every session and has all different forms or fashions is a CON bill, Certificate of Need bill. It seemed like we kicked it around in committee, and it came out, and I think it died once, and then it resurfaced and came out in 3 or 4 different forms. What is Certificate of Need bill, and why was I know the Hospital Association was against that bill, and tell me why.
Sure. Certificate of Need is a state planning process where basically before you look at a new healthcare service, you look at the need to make sure there's enough volume to support a new program. So West Virginia is one of 30 states that use Certificate of Need as a state planning process for healthcare. And the opposition, who would like to get rid of CON, believes that it should be a free market, let anybody open up a program. The problem is when you're looking at CON, healthcare is not like any other free market. When 75% of our patients at the average hospital is covered by governmental programs, Medicare, Medicaid, PEIA, that all reimburse below cost. So what they're really looking at is they would like to siphon off those commercial patients that pay above cost, but then that weakens the hospital's ability to provide other services, like emergency services 24/7, trauma care, child abuse. So this has been that issue, and that's why the hospitals strongly oppose weakening or eliminating the certificate of need planning process. So there was a bill this year that would have actually eliminated CON. It failed in committee. And then the supporters of that bill tried to bring it back on the floor through another vehicle, and we were able to beat back those efforts as well. There was some other discussions about, modifying CON for birthing centers, opioid treatments. We don't oppose that because we can clearly, modify CON as appropriate, but we cannot get rid of the entire program.
It seems like, yeah, it did. It came back in multiple forms. We could never went away, but certain area of the state, maybe some of the rural areas or something. It just seems like there's not a one-size-fit-all. You can't just go in there and do away with certificate because it affects so many people in different ways. But a lot of the hospitals, like you said, from a standpoint of West Virginia, we got to service the needs. Mm-hmm. And the last thing we need to do is open that up to everybody. And now everyone is providing all these services that have an overabundance of them. So
well, and that's the thing is when you look at some services, I know some people say, oh, well, it can be cheaper if you go to an ambulatory surgery center versus a hospital. Well, one of the differences in ambulatory surgery center is not 24/7. And I think that's one of the differences. You don't pay staff to work midnight on Christmas Eve because they're closed. Well, you have to pay a premium to get those staff and ensure those services because the last thing you want is to show up at a hospital and they're not available 24/7. That's the biggest difference.
Hey, I know we're not going to hear the last of certificate need, and I'm sure it'll come back up again next year, and we'll follow that. But I don't think that's going anywhere anytime soon. So, hey, another bill was it was called the PEIA Finance Board, mm-hmm. Senate Bill 205. It passed the legislature, and it added 2 individuals to the current PEI Finance Board. Well, why was that important to you all, and what does that do for the average West Virginian?
Sure. For the average West Virginian, we don't have much of an impact, but what it does do is it provides 2 providers to the PEI Financing Board. So when they're making decisions about premiums, access to care networks, we now have a provider voice on that group, which is an important piece because if PEIA is ensuring a benefit, you want to make sure they actually have access to care. So that's why that provider voice on there is an important component.
I see. Hey, one bill that it seemed like there was a lot of talk, of how a hospital manages themselves. There was a bill, there's a vaccine proof bill. Mm-hmm. I think it was House Bill 4012, and it was 2 things: showing proof of vaccination, aligning state law with federal law. And you had to show a proof, but there was a lot of argument, well, just let hospitals, run their own business and whatnot. But it seemed like there was a lot of things that trying to tell you what you can and can't do. Was that a bill that affected your organization, or?
Well, at first, when there's a lot of talk about showing proof of vaccination to go onto either a governmental program, go into a governmental premise building, or a hospital, none of the hospitals were requiring proof of vaccination to come onto the campus. Now, there was a question about employees, because earlier last year, CMS, which is the Centers for Medicaid and Medicare Services, required hospitals and other healthcare facilities that receive Medicaid and Medicare dollars to require their staffs to be vaccinated. So this is something the hospitals started to implement that, and there was a question whether the state of West Virginia should make that an option. We can't. We cannot survive without Medicaid and Medicare funding. That's a federal requirement. We had to implement it. So that bill, the second part of that bill, not only had the proof of vaccination, but it then modified a bill from the October special session to be consistent with CMS federal policy.
I see that it was one of those things where it's like, listen, you would think that the hospitals know how to handle COVID. We were operating. There was a couple other bills that didn't advance, but it was a constant kind of same theme, reoccurring theme, providing for fines for hospitals do not allow a certain visitor during COVID. I mean, relating to child immunization bills that maybe weaken or roll back the walls. And then one that I would like you to touch on was House Bill 4351. It didn't pass, or House Bill 4581, which is providing a way to increase our nursing staff.
Yes.
Talk about real quick the nursing shortage that we have in West Virginia and what can we do. And I don't think much was done this session at all to address our nursing shortage. There was something the governor introduced, but that's going to take some while to evolve. Is that correct?
We have a huge staffing problem in West Virginia. And actually, we had a staffing challenge prior to COVID. I mean, right now, about 50% of all nurses in West Virginia are over the age of 50. So you have a graying profession, and we have an increased demand as the population ages. And this is not a unique West Virginia challenge. It's a national challenge. And in fact, there's more than 210,000 vacant nurses positions today nationwide. The entire hospital workforce in West Virginia is 49,000 people.
Oh, wow.
That's doctors, nurses, phlebotomists, techs, it's everybody. So it shows you how big the problem is. You're exactly right. The governor announced a $48 million initiative back at the end of last year to help increase the number of nurses over the next couple years. That is a long-term fix, we agree. He was actually very supportive with the Save a Care initiative, which provided hospitals some emergency funding to help compete nationally for travelers, help retain staff by offering retention bonuses, overtime pay. So that was the immediate effort to try to deal with the staffing problem. This is not an easy solution. We need to find ways to attract young people to the profession, get them in, making sure that in middle school and high school, they're academically prepared to move into these professions. And we've been working with the Higher Education Policy Commission. How can we produce nurses faster? So instead of being in a 2-year program, could you do it in 18 months? Could you move some of the EMT programs and support EMTs, because there's also a shortage with EMT staff. So it's not just nurses, it's the entire healthcare profession.
Well, yeah, like you said, I mean, I know there's always bills that how can we do to incentivize nurses to either stay in the field or go into the field, with tax incentives and whatnot. So I think we're coming to almost a crisis mode when it comes to the staffing shortage of the hospitals, especially with our elder population as well, too. So, well, we hear it right here firsthand. It's a pleasure having you on the show today. I know healthcare is always at the forefront of all West Virginians, and I'm sure we'd like to have you back on the show and continue to see how the PEIA situation gets addressed. So
thank you for the invite. Glad to talk anytime.
Thanks for being here. Hey, we're going to take a quick break, and we're going to come back with Abby Reel, who works with Mountain Health Network, and really get a deeper dive into some of the hospitals that she works with and how these pieces of legislation may affect them.
We know who we are, where we've been, where we're going. Like hospitals all over America, we are changing, redefining, restructuring ourselves to be the best community health system in the region we serve. We are 2 hospitals with more than 30 locations, 450 providers, and 1 mission: to heal. As one, we are Thomas Health, caring for our communities today and tomorrow.
Proudly advocating for workers and their families, the West Virginia AFL-CIO is a group of 600 labor organizations representing 70,000 active and 70,000 retired union members. We represent first responders, healthcare workers, educators, coal miners, construction workers, plant workers, truck drivers, grocery store clerks, and every job in between. We believe every worker has the right to fair wages, good benefits, and a safe workplace. That's what the West Virginia AFL-CIO fights for every day.
A new day begins, and what happens today must be covered, reported, and passed on to everyone in the region we serve. We are journalists, staff writers, editors, storytellers. Who are we? We are HD Media, trustworthy and always here for the times we live in.
What started as the Parmar Oil Company in 1967 has grown into 116 convenience stores in 4 states. Parmar convenience stores offer monthly product specials and grab-and-go items. Located just down the street from where you live, Parmar stores are all about being your above-par convenience store. If you don't have a Parmar store near you now, you will soon. Parmar Convenience Stores, neighbors serving your community and making life a little bit easier every day.
Looking for a friendly bank that you can turn to in your community? Bank where the decisions on your needs are made locally. With online banking and 7 locations. Poca Valley Bank, where relationships matter.
Welcome back, everyone, to Outside the Echo Chamber. We just heard it right there from President Jim Kaufman of the Hospital Association. Well, now we're going to turn over to Abby Reel, who is the Executive Advocacy Officer for Mountain Health Network. And it's a cooperative nonprofit organization that works with Cabell Huntington Hospital, teaching hospitals at Marshall University, St. Mary's, and Hoops Family Children's Hospital. Abby is their Director of Advocacy, so it's a pleasure having you on the show today. I saw you around the Capitol. We had a lot going on this session, didn't we, Abby?
Yes, we did, and thanks for having me today, Doug.
Oh, I'm glad. We like to take a deeper dive into some of the pieces of legislation and how it affects, the organizations that you work with, especially the hospitals and all West Virginians. One bill that came up this year was House Bill 4112. It relates to pharmacy benefit managers, PBMs, we like to call it, where retail pharmacies that work on behalf of the insurance companies manage the prescription drug benefits. Yes. Tell me about this, and why was this one of your priorities, and why was it so important?
Since 2017, West Virginia has actually led the way. The West Virginia legislature has led the way on PBM reform. So when it comes to managing and seeing those pharmacy benefit managers, West Virginia was one of the first states to actually license those entities. You never really know what's going on with pharmacy benefit managers behind closed doors. Pharmacy is one of the toughest things to figure out in healthcare. Pharmacy cost is always a big thing that we always talk about. The legislature always looks to try to manage for patients that cost. And so this is just one of those pieces of legislation that kind of builds on what we've done since 2017 in West Virginia. And what this piece of legislation actually did was allow for pharmacies in West Virginia to deal with specialty pharmacy drugs. So Humira is one of those. During session, we actually talked with some legislators who had their specialty pharmacy drugs changed due to their PBM. So there's things like that will affect, that this bill allows us to do, and it also codifies our legislative rules that we did last session that deals with pharmacy choice. So that was really big for us.
So is it designed to help drive the drug costs down, or is that what it's designed to do?
Yes, and to be able to allow for access for patients. So rural West Virginia, we have many patients that they can't access our hospital pharmacies. They would have to drive hours. So being able to access a Fruth pharmacy or a local independent pharmacy was really the aim at this legislation.
Well, it sounds like, people were excited about it. You were happy to see this bill pass.
Yes, we were. Yes, we were. It was a difficult one.
I know you worked hard on that. Hey,
Yeah.
another bill is not technically related maybe to healthcare, but it was an interesting bill. We had Steve Roberts and Brian Dayton on the show earlier in the week, and it had to do with daycares offering a tax incentive for organizations that provide daycare or child support. You tracked this pretty closely as well, too. This was one of your all's priorities, I believe. Tell me why, and how will this affect your hospitals you work with?
Prior to session, we had actually been looking at child care. So, nursing shortage is big, but healthcare workforce shortage is big in general. And so one of the things that we recently did was a survey of all of our employees along with Marshall School of Medicine, Marshall Health, and we had almost 2,000 people out of our 6,000 employees respond to that with a need for child care. And so that has alerted us to look at what can we do to provide employee type of child care. And so getting involved in that legislation was key for us because it's going to cost a couple $1 million to put something like that together for us. So that's something that we were definitely supportive of.
Do you have any people in your network or hospitals take advantage of this, or they're talking about taking advantage of it?
Yes, definitely. Definitely. It was in the works, and it's something that's only going to help us even further.
Well, I know that was one of the Chamber's priority bills as well, too, and the same thing you said about getting people back to the workplace.
It's big.
How can we bring you touched on nursing shortage there for a second. We didn't seem like we did a lot to address the immediate need of nursing. I mean, you're seeing a lot of traveling nurses come into this state. I mean, what more can we do to help address that shortage right now?
I think it's really, at St. Mary's Medical Center, we actually have our own nursing program. And so we are actually expanding that thanks to the governor and thanks to many pieces of funding that we've gotten over the last year. And so being able to expand, I think, the educational capacity, looking through K through 12 education as well, because, having people prepared for those types of programs is big. But looking at also lab tech, phlebotomy. I mean, we have a need for every type of healthcare worker you can think of. So really trying to steer our K through 12 folks into those types of arenas. But then recruitment-wise, we've got to look at stuff like childcare. What are incentives to get young people here to West Virginia? And I think you guys are doing a good job looking at that. There's always, more that we can be doing.
Well, I think, we have a lot of traveling nurses now. It's our job to try to keep them here.
Try
to convince them to stay here. Anything we can do. They come here, they work, and we want them to stay and raise their families here. Hey, switching gears a little bit, we talked a lot about mental health this session and what's going on, not just on college campuses, but all across West Virginia, and how it extends over to homelessness and public safety and health. There was a bill, House Bill 4377. It streamlines the involuntary commitment process for patients and law enforcement. A lot of folks here have this involuntary commitment, and you understand that it maybe makes them a little nervous, but would this help with the overcrowding in jails, or what's the intent of that bill?
The intent of that bill is we made a lot of changes back in 2020. And so one of those changes was to allow for our ER physicians to hold a patient for, I think it's up to 72 hours until a mental hygiene could be done, because the process can take some time. If it's a weekend, good luck getting a hold of anybody. Yeah. And so this bill really helped with those timelines, but it also helped on the medical clearance piece. Because that was something that DHHR had put in 2020 that really held up the system. So we could have a patient sitting in the ER for 8 hours waiting for a clearance, which is not the place to be for a psych patient. And so this also allows for a pilot program. It allows for alternative transportation. And so those are things that this bill will now allow us to do here in Cabell County.
So can you do that remotely, or does it all have to be done at the hospital?
It's for the evaluation, it's to try to do in person, but if it's not able in that time frame, because it's a 2-hour, they have to turn around an evaluation within a 2-hour period. So if they're unable to do that in that 2-hour period, then it would be remote.
I see, because I know I talked to a lot of the county jail officials and people as well too, because it takes up their time. I think they have to actually stay. They have to stay with the person.
County sheriff does.
The county sheriff does.
Yes.
Okay, I knew they had to stay.
Now hearings can be done remotely.
Oh, they can
with
be done
Supreme
remotely.
Court, yes.
Okay. Well, I know there's a lot of stuff there, and it's kind of a trickle down effect.
Yeah.
It affects with a lot of stuff going on here. Hey, a couple other bills we were talking. There was a telestroke bill. There was a telehealth and all that. Talk to me about the importance of where we are with that.
West Virginia last year did telehealth payment parity, which is huge for providers here in West Virginia. But this year, you all put another line item in for $1 million towards telestroke. And so that is big for our state. The 3 hospitals, CMC, W, academic medical centers, essentially us, along at Cabell and St. Mary's, are able to partner with other smaller hospitals in the state to provide telestroke to those entities.
So is that something that we just put in? Like, it's like a one-time shot, or is it
It's been
every
in
year?
the last 3 years, I believe.
And you've seen.
And so it came again this year.
Oh, okay,
so that was exciting for us.
That was something I think you were pushing for as well too.
Yeah.
Now, any other pieces of legislation that didn't get through that you're disappointed in, or?
Nothing that I can think
felt
of.
pretty
It did.
good?
We felt pretty good. I
All
mean,
right.
it's there was a lot on vaccines that you could hear about, but we didn't see much run on that with childhood vaccines. That's always concerning for us, especially with our Hoops Family Children's Hospital. Nobody wants to be taking care of a child with pertussis when we can prevent that. It's things like that we were lucky that things like that did not get on an agenda or make it through.
One bill I was disappointed to not see, and I'll let you close with this, is how this affects actually West Virginians, was the insulin cap. Not having a cap on the insulin. It seems like that was the diabetes rate in West Virginia, and so many people. I mean, this was something near and dear to a lot of people, but it died. It died in the Senate, I believe.
In the Senate, yes. And I'll say that's why the pharmacy benefit bill that we did do, the 4112, that is key when it comes to managing patients with diabetes, because we do have 340B protections in there. So if a patient comes in and they're having issues trying to get a hold of their $500 insulin, whatever it may be, hospitals are able to use that 340B drug savings to help that patient.
So they get a little bit of help when it comes to that. So I think there's still work that needs to be done
Oh,
on that
definitely,
insulin copay.
definitely.
I think a lot of West Virginians, we talk to them all the time, and they think this is something that we definitely need.
Definitely.
Well, Abby, I know this isn't the last we'll see of you. You're always working to the benefit of all West Virginians and the organizations you represent. And thanks for coming on our show today.
Thank you, Doug.
I'm glad it was a good session. We got a lot accomplished.
Yes.
Hey, we're going to take a quick break, and when we come back, you think tanks or just for the universities? Well, we're going to talk to our next guest here, Charles Mcelwee, and talk to you about what he thinks we can do to move West Virginia forward.
We know who we are, where we've been, where we're going. Like hospitals all over America, we are changing, redefining, restructuring ourselves to be the best community health system in the region we serve. We are 2 hospitals with more than 30 locations, 450 providers, and one mission: to heal. As one, we are Thomas Health, caring for our communities today and tomorrow.
The relationship between a lawyer and a client is based on trust. You have to make certain that the lawyer you hire has your best interests at heart. We typically meet our clients at the worst times of their lives, and it's our job to help them. Over the years, we've been entrusted with some of the biggest cases in West Virginia. That's because we have a track record of success and getting exceptional results. We built a reputation as one of the go-to law firms throughout the state of West Virginia.
Joining me, high-profile lawyer Ben Salengo. Ben, it's a real honor to have you on.
In fact, many of our cases come from other lawyers. Lawyers who've worked with us, lawyers who've worked against us, and even those who've merely heard of our results. We're proud of the reputation we've earned in the community for providing exceptional, aggressive legal representation. When you hire my law firm, you don't get excuses, you get results.
People keep asking me how Todd Judy Ford has the best selection of vehicles at a time of national shortage.
The secret is our 130% of Kelly Blue Book for your trade-in.
Everyone wants to trade the car with us and get more money.
And now we're making it even better.
We will beat any other dealer's trade offer by $1,000 guaranteed.
If we can't beat it, we'll just give you the cash.
So bring in that car, upgrade your vehicle, and get top dollar for your trade-in now.
Just go to ToddJudyFord.com and see for yourself.
Hey, welcome back, everyone, to Outside the Echo Chamber. I'm really excited to have our next guest with us right here, Charles Mcelwee. He worked really hard building Robinson & Mcelwee, Charleston-based law firm here for numerous years. And at 94 years young, you would think he's ready to just retire and enjoy life. Well, that's not the case. Charlie is just as active as he's ever been, meeting with people because he wants to do whatever he can to see West Virginia thrive. He wants to see us succeed. He's constantly writing editorials in our paper. He's met with Lee Wolverton and myself, and there was a column in Saturday's paper, Getting It Right in West Virginia by Lee Wolverton. Charlie wrote a column about what the two mayors in Huntington and Charleston are doing to think regionally, to think about our economy from regions across our state. So at this time, we have Charles Mcelwee. Welcome to the show, Charles.
Thank you, Doug. Glad to be here. Appreciate it.
You are constantly writing. You're writing for the betterment to move West Virginia forward, and you have this idea about think tanks. You know, we met with University of Charleston president Marty Wright, and we've talked to John Deskins and all the great stuff he's working on. So tell me, why are you so driven to help move West Virginia forward? You can retire. You can take it easy. Tell me about it.
I don't know why I'm so driven. It's a part of my nature, and I'm really retired from the practice of law. And if I had to stay at home or do anything else, I wouldn't be here today because I'd be dead.
Oh.
So I don't know. It's just my nature.
Sure.
And I'm really driven by it.
So talk about this think tank idea. What do you want to do? You talk about think tank. Talk about that. What do we need to do?
Okay, Doug, I have a thesis, and it's this, that unbeknown to most of the population of the state, West Virginia is beset by multiple problems that inhibit the improvement of the prosperity of our citizens and our businesses, and two, that these problems are so deep-seated in West Virginia that they cannot be solved by off-the-cuff extempore proposals, as has been West Virginia's predilection. And the first one of these problems is our state's demographics, that is, the state's population. And this is a problem, first of all, relating to our loss of population.
Yes.
Between the 2010 and 2020 censuses, West Virginia lost a larger percentage of its population than any other state in the nation. And that caused the WVU, Bureau of Business and Economic Research, to proclaim that our demographics is a real inhibitor for our growth moving forward.
Now, you write a lot. You're a fantastic writer, and you write, I don't know how many times a week. You're writing things to us to review, submitting for editorials. You're a deep thinker. Now, you had mentioned in your last column about the two mayors of Charleston and Huntington working together. Now, you're saying they have it right. Tell me what you mean by that. Why do we need to work together as a region?
Okay, that's the fourth thesis of mine.
Okay.
That from a standpoint of planning economic development, we need to think regionally. That's not my original thought. That came from John Deskins, who heads up the West Virginia University Business and Economic Research Policy. He's the one that gave me the idea that it was sound thinking to think regionally in developing our economy. And he had divided the state into a number of regions. And let me just give you an illustration. He focused on the coal-producing or ex-coal-producing counties, 7 of them in southern West Virginia, as being one region. And then let's compare that to the Eastern Panhandle, 3 counties. I think everyone would accept that the development of the 7 coal-producing counties in southern West Virginia present a challenge of how we're going to improve the economy of those 7 counties versus the 3 counties in the Eastern Panhandle.
That's a whole separate region over there. Yeah, that's a whole different.
Those are 2 entirely separate regions of the state, and they present different challenges. The biggest challenge is how do we improve the economy for the people and the businesses that reside in the 7 counties. When John Deskin says think regionally, then who's going to do the thinking regionally?
Right. Yeah, that's what I was going to ask you.
It can't be done, in my opinion, by off-the-cuff proposals. It requires deep thinking and study. And that's where in that column you referenced, that I proposed that we established at Marshall University a think tank or an Institute for Public Policy Research. We have there a new president who himself is a alumnus of Marshall University.
And a deep thinker. He's a deep thinker as well, too.
A deep thinker. He went out west and became CEO of an outfit called Intuit Corporation, and made it very, very successful, came back and is now the president of Marshall University. So I think with that leadership and Marshall's location, make it the ideal place to establish a think tank for the development of the economy on a regional basis in West Virginia, because it's closest to those counties that are going to present the biggest challenge.
And you talked about we need to collectively pull people together. And it seems like everyone's doing their own thing.
Exactly.
And you want to bring everybody together.
Exactly.
Work together and put together a real plan, not just Band-Aid here, Band-Aid there, right?
Now, that's right. We need some deep thinkers. And I propose establish a think tank at West Virginia University and one at Marshall University. Okay. The one at West Virginia University would focus on 3 things. 1, how to improve the demographics of the state. It would also, I'm not condemning our public school system, but I think it's way past time that we do some deep thinking about our public school system, particularly 2 aspects of it. One, the first one would be our learning teaching model, which is based on a Prussian model of many decades ago, in which the kids just advance by age from grade to grade. That's one thing that's possible. Or are we going to look at it from the standpoint that we don't move a student forward until they've grasped what is in front of them first? So then the teacher qualification needs to be looked at. And I propose that in both regards we should look at what are the best practices nationwide today.
Now, Charlie, before I let you out of here, you're always writing. You can give us a preview of what's to come. What's your next editorial, or you have anything in the works yet, or are you going to keep it a secret from us?
No, I've got one ready to go.
Okay.
And it's captioned, Thinking Innovatively to Address the State's Critical Concerns.
There you have it right there, a little sneak peek. I can't wait to
Innovatively.
read it.
Now, both universities should be staffed, and here's where the legislature comes into the picture. In my opinion, the legislature should establish a think tank at Marshall and one at WVU. And endow them with sufficient funds to engage some deep thinkers. Go on a nationwide search. Go on a nationwide search, for example, with respect to finding people largely on the youthful side that have shown remarkable success, maybe in the field of education, and engage those people on a year-round basis, with their initial foci being on, for WVU, these 3 areas, and for Marshall on the one area on economic development. And we've got to have, on a year-round basis, some permanent people who are deep thinkers. And now here's, it would go beyond this initial 4. For example, the legislature might say, well, we need some deep thinking on this subject.
Yeah.
And we're going to ask WVU in its think tank to focus on that for the next weeks or months and give us your best ideas of what we should be doing in that area.
Well, we've got some fantastic institutions in this state. We got some great leaders at those institutions, and we just need to tap into them. And I'm going to leave everybody with this, Charlie. You use a term, and first up, thank you. Thank you for doing this and taking on this challenge because you love West Virginia. You've built a successful law practice here. You could be hanging out up there and just fishing or hanging out on that lake and relaxing, but I know you drove here in your truck and you care. You care about how you leave West Virginia, and you want to see something put in place to move our state forward for years to come. And you use one word. I'm going to leave everybody with this one word: common endeavor.
Common endeavor.
2 words. Common endeavor.
That's right.
We have a common endeavor to work together to move West Virginia forward.
That's right. One of the challenges we have is coalescing in a little group.
That's right.
Everybody's going on their own ideas. Right. We've got to coalesce. We're going to get it.
Well, Charlie, we're running out of time here today. I know we're going to meet. We continue to meet, and thank you for everything that you're doing to bring people together, create a think tank, and then finally do something great for all West Virginia.
Thank you, Doug.
Well, there you heard it right there from Charlie Mcelwee, my good friend, 94 years young, who wants to do whatever we can to bring a common endeavor to make West Virginia grow and survive. We'll be right back with our final wrap-up segment here in just a moment on Outside the Echo Chamber.
We know who we are, where we've been, where we're going. Like hospitals all over America, we are changing, redefining, restructuring ourselves to be the best community health system in the region we serve. We are 2 hospitals with more than 30 locations, 450 providers, and 1 mission: to heal. As one, we are Thomas Health, caring for our communities today and tomorrow.
A new day begins, and what happens today must be covered, reported, and passed on to everyone in the region we serve. We are journalists, staff writers, editors, storytellers. Who are we? We are HD Media, trustworthy and always here for the times we live in.
Well, thank you, everyone, for joining us on Outside the Echo Chamber. We had a fantastic show today. Jim Kaufman, President of the Hospital Association, Abby Rill, Mountain Health Network, and my good friend Charles Mcelwee talking about deep thinking and moving our state forward. Hey, tune in right here every Tuesday and Thursday at the West Virginia Gazette Mail.com, HeraldDispatch.com. All these shows are archived, and they hang out there on our streaming page at both of our websites. Hey, let us know how we're doing. Give us some feedback. Tell us what issues you'd like us to cover. We're bringing this show to you so we can take a deeper dive into all that affects you as West Virginians across our great state. Hey, I want a big thank you out to Dan Shreve and the Media Center, and Ethan, our director back there, and Maria Young, our producer. Can't do it without them. Email us at OutsideTheEchoChamber.com. Let us know what you'd like to hear about. As your host today, I'll see you next time, Tuesday, 9:30 a.m., right here on all our channels. Thank you very much. Have a great day, West Virginia.